Thank you. So my talk is going to be a little bit different and a little bit unique, and we sort of broke the cardinal sin of not running a test if you don't know what to do with the answer. So I'll start with that disclaimer, but we'll see how this goes. So many of you probably already use processing fluids, and of course they're easy to collect. Many farms are already collecting them because they want to reduce pathogen spread from pigs that are shedding PRRS, for example. They don't want to disseminate that through the farrowing house. So we should be collecting tails and testicles anyway, but then it creates a nice fluid that we can test for other things. In many cases, we can actually save this fluid and then test later, so even if we don't want to go through the expense of testing up front and testing weekly for something we don't think we have, it can be easily frozen and stored. So we've done a lot of testing for PRRS. Many are doing testing for PCV3 and 2. Hyrhinus can also be tested on processing fluids. So Mycoplasma hyopneumoniae is probably something that you wouldn't think you would want to test processing fluids for. So a little interesting sidebar, we did a project a couple years back with Jake Baker as a student project, looking at PRRS and looking at the number of positive testicles or tails that you had to put into a group or a batch in order to infect that. And we were working with BI, and the BI HMC lab ran kind of a gamut of different tests just to see like what else we could use processing fluids to test for. And lo and behold, we got a positive for Mycoplasma hyopneumoniae. So I thought that was strange and sort of glossed over it. And then she had shared the results with Maria and Carl's Valletta. And Carl's and Maria both took the time to say, well, wait a minute, like, this is weird. Like, we should probably look into this. So that sort of led us down our path of looking more in depth into that. And there have been a few studies since then that have looked at that. So what have we seen in the field? So positive stable farms, if we do test them via processing fluids, they do come up inconsistently positive. And I would define positive stable for Mycoplasma that we occasionally will see very late clinical myco, but most of the time we do not. So generally free of clinical signs, good gilt acclimation program, that sort of thing. Unstable farms, we definitely more consistently find positives in processing fluids, and we find that it at higher amounts or lower CTs. We believe we are detecting it much earlier on farms that are breaking, and maybe possibly detecting farms that we previously would have thought to be naive or negative. And we have been able to actually sequence 2 different strains thus far on processing fluids. So it doesn't seem to be, at least, strain specific that we can tell yet. Again, it's sort of that big question mark, how is it getting from the lungs into the processing fluids? And I'm not going to be able to answer that, but somehow it is. So we did an initial pilot collection of processing fluids from known positive and known negative farms. This was based on the flow history, and the negative farms would have been naive negative. As far as we knew, stock negative, negative for 15 years, that sort of thing. And it was a very small subset, but we did find on the farms that were positive, we were able to detect it, and in the farms that we believed to be naive negative, we did not. So then that led us to continual monitoring on a positive stable farm. We also then led us into another project of longitudinal sampling. So we knew we had positive processing fluids, so we decided to follow those pigs out into the nursery and then follow those out into finishing. And then lastly, we've been doing ongoing surveillance on 4 farms, 2 of which were naive and broke, and the other 2 were believed to be naive, and there'll be more to come on that. So some of the confirmatory testing that we've done, so we have done deep tracheal sampling in the nursery as well as finishing to confirm the positives that we had on processing fluids. We did deep tracheal sampling fairly in depth on the positive farm that we found that we believed to be previously naive to the detection of greater than or equal to a 3% prevalence. And we are currently doing another 216 sows from that farm because our first round came back all negative. So either it's a very elusive bug, it's just maybe we're at a less than 3% prevalence. Not sure about that yet. And we've also done laryngeal swabs for confirmation. We've done some serum sampling, and as Alyssa alluded to, that can be pretty tricky to interpret. On most of our farms, we had used a vaccine on them that would have elicited an antibody response, so trying to kind of sort through that, whether or not it's an actual infection or response to vaccine has been a little tricky. And of course, if we can sequence, we have been. So this is our positive stable farm monitoring that we've done. So all the samples on the very top there are all samples that were tested and negative. All of this we've been pooling by day. So all the pigs that would have been processed that day, that serum was then saved, and we try to freeze it within the same day, although to be honest, they're not always great about freezing the same day. So it would be frozen within a few days. And then the yellow line there would be positive line here and below. Between the red and the yellow would be considered suspect. And then of course everything up here was a negative. In this farm, we did actually have a PRRS break. So obviously we know when we get PRRS, we tend to shed everything else we have on board, and Mycoplasma is one of those things. We did whole herd serum at this point, and as you can see, we definitely picked up on our number of positives that we were getting in suspects. So I'm sure a lot of you are thinking, okay, how do you interpret a suspect? But as was mentioned earlier, when you're looking for Mycoplasma hyopneumoniae, it seems to be fairly hard to find, and you don't tend to get a lot of suspects unless something's really there. And so that's how I'm looking at this, knowing that it's a diluted, pooled sample. So our longitudinal sampling that we did, just to kind of guide you through this graph, so our percentage of positives and suspects are represented in parentheses. We did 55 deep tracheal samples per nursery, and that would have been at a 7% prevalence rate. We did 30 at a 10% prevalence rate of bronchial swabs at the packing plant. And then we did, for one flow, we did an additional 30, so we were up to a 60%, or 60 samples for a 5% prevalence. And then also to point out, the farm, the positive stable farm here, we were able to match the sequence from the farm to the multiplication sequence. So it was not a lateral mycoplasma that we picked up in the study. And then the difference between these two farms is that they actually have different multipliers, different gilt sources. So the mycoplasma sequences that we picked up were different. So as you can see, we did pick up positives on the processing fluids, and we did find positives later on in our positive stable flow. This is I would say fairly virulent mycoplasma. You know it when you have it. The gilts tend to cough a lot in the GDU, very clinical. Our other positive unstable flow, the gilts, when naive gilts would come into that farm, you really wouldn't know you had mycoplasma. They have very little cough. They don't seem to act clinical at all, but we were able to find fairly high cycle times on the processing fluids. I think our highest might have been 23. Got a sequence off of that, but as you can see, even though we were unstable, we were never able to find it later on. And so maybe it's a strain difference, maybe it's a wimpy strain, not sure, but that was the results of that. So our continual farm sampling, so just to orient you, so farm A would have been a multiplier farm here. That would have sent gilts to farm D, farm B, and farm C. Farm F was at the time not in our system. So we actually believe that we had a lateral infection from this farm to D, and the sequences matched on that. And then this farm D then infected farm B. We did, so in our sampling that we've done, this is a 6,000, this is a 6, this is a 6, and this is our 1,400 head multiplier. So we did confirm B and D as an outbreak. It was very obvious clinical signs. We're able to confirm with laryngeal swabs and tissues. And then just in addition, so we did close farm B to try to eradicate mycoplasma, and then we closed farm D because they also broke with PRRS. This is probably from the same farm at the same time that they broke with mycoplasma. So this was the overall results of our sampling. So as you can see, we actually had fairly similar cycle times throughout the 4 farms. However, the 2 farms that actually were more clinical did have lower cycle times and overall more positives, whereas the 2 that are non-clinical, we had a lot more suspects. So this would be the multiplier farm, and this is sampling over time. So as you can see, lots and lots of negatives. And then we start to pick up some suspects. So we were thinking at the time, like, uh-oh, it's infected with the same strain. But we weren't hearing any cough, we weren't seeing anything, and we really started sampling here just as a matter of completeness, just so we knew for sure we had a negative guilt source to be able to enter in at the end of the closure for the other 2 farms. So to surprise, it was like, uh-oh, we're starting to get these positives, so we were kind of waiting for the other shoe to drop and waiting for the clinical signs, and it never happened. So then we ended up getting this true positive, and we thought, gosh, we better go in and do some investigating. We need to confirm this. So that's when we did that deep tracheal sampling, and of course they were all negative. And as you can see since then, the trend line seems to be going down or more positive. So we went in again, and this was just last week, so we do not have results from the second sampling yet. So those are pending, but that's sort of what that one looked like. This was our other farm. This would be the 6,000 that last farm feeds into. So again, you'd think the longer those gilts are living, the more likely we are to have them shed. So if we're going to see this anywhere, you would think we would be seeing this here. And there's something there, and we're getting some suspects, but we're sure not getting very many. And there's no cough, and there's no clinical signs at this farm. So this would be our obviously clinical farm that we confirmed the sequence with the neighbor. So we did a herd closure here, and as you can see, we had lots of positives after that, and then we started to get some negatives. And so to me, it looks like we're starting to stabilize, which would make sense from the herd closure. And this is our last farm. This is the one that got the Mycoplasma and PERS. So a couple things happened. So initially, we actually ran some Denegard in that farm for other reasons. Maybe might have suppressed the Mycoplasma in hindsight that we didn't know we had. And then we had our PERS break right about here. And then we did start to pick up some Mycoplasma and had a positive initially, some suspects. We decided to go ahead and booster the whole herd. At this point, at the same time that we did serum to the whole herd, and again, like that flared everything up. So we see a lot of positives here. Now we did have our last PERS positive on processing fluids, but you can see that we're still picking up a decent amount of Mycoplasma suspects. So it isn't going away just yet, but it does seem to be stabilizing a little bit. So what do we know? Farms B and D have a higher frequency of MHP detection by PCR and processing fluids, and they did have the clinical signs in the sow farm as well as downstream. Farms A and C, so that was our multiplier and our other non-clinical farm. So we were able to detect it, but we have yet to see any clinical signs there. We are unable to find it anywhere other than processing fluids, and we have been able to sequence it, and of course the sequence did not match the others. And so again, maybe it's a weaker strain. We're not really sure at this point. And that farm A, in my book, I'm considering that to be positive, or at least for sure suspect. Considering that we found a strain, we were able to sequence it. I consider that pretty significant. And over a 9-month period on a naive herd going into a break, or presumed to be naive, we're able to find it at around an 11% positive rate on processing fluids. So just overall, this is what the dendrogram looked like. So just the farm D and farm F, as you can see, they lined up. That was the lateral situation. That's actually another farm in our system that's Mycoplasma positive, different multiplier, which is actually pretty similar. And then that is the non-clinical farm. So as you can see, a fairly different branch there. Interestingly enough, the other farm is within our system up here. They would have had historic shared guilt sources. and we're talking like 15 years ago. When this in a Farm A was initially stocked, it would have been the same multiplier that would have come out of a grandparent farm from this. So if possibly it's a very low virulent strain, maybe that would be a way that had gotten into that farm, and maybe it's always been there. But I guess stay tuned. We don't really know for sure about that just yet. So I'd like to acknowledge Boehringer Ingelheim for the continued sponsorship, University of Minnesota, Maria, Carls, Amanda Sponheim, Levi Johnson, our other veterinarian, and then our veterinary students, Gabby Fry and Rachel Sitka. And with that, I will take any questions.
Thanks much, Deb. A truly different topic indeed, right? Okay. Do we have questions for Dr. Murray? So we thought we had it complicated with, with the ELISA and the sensitivity and oral fluids, blah, blah, blah. So now we throw in processing fluids.
Sure.
Just to make it more interesting.
Right.
But would you say, Deb, that would you recommend others to go and try to test these in their farms to see what their status is? Or, at this point, with so many doubts that we still have about it, what would be your perspective, for your fellow practitioners in the field?
I think it's just something that we need to have more information and more data on. So I guess I would recommend, for the good of the group, for other people to start doing some testing, so at least we can sort of start to establish some sort of baselines and see if maybe our results are totally unique or maybe perhaps they're not. But I do think at this point, so we would have, without processing fluids, farms A and C, we would have never suspected them as having mycoplasma. We would have completed the closure in the other farms and just rolled on ahead, thinking we were entering naive and negative gilts back in after the end of the closure. So it maybe could explain why some herd closures have potentially failed, because if you don't have any clinical signs and you would never suspect a test, and you do test, and you can't seem to find it, but yet it's there. Maybe it's a very sensitive way. But at this point, without more farms and more people testing, we'll never know.
So just curious, you're testing processing fluids at the sow farm. Mm-hmm. Does this then trigger downstream testing right away in the growing phases to see if there's anything happening downstream that may have been seeded at the sow farm level?
Yep. So the farms initially, when they broke, they were very clinical, and so we had coughing, like Mycoplasma coughing pigs, like early nursery, So it was very, very unstable, obvious, and then we did some tissue work and some other testing, as well as within the farm. If we found a coughing animal, we did laryngeal sampling and we bled her just to verify the results that we were finding on the processing fluids.
So I guess then a strategy or a reason for doing processing fluids might be not only to detect it early at the sow farm, but for to trigger early intervention in the growing phase to minimize losses, perhaps trigger a vaccination program or something like that.
Yep. Yeah. And the other thing that I look at it is like on the tail end of a PERS break, we're able to detect PERS on processing fluids, maybe in situations where we may have missed it with serum just because we didn't test enough. And so maybe in a mycoplasma closure situation, maybe that's something that needs to be looked at to determine if we've truly eradicated it before we're bringing new gilts back in.
Thank you for your talk. Did you have the chance to check parities from the positive processing fluids? I was wondering if there is somehow, I don't know, from those positive processing fluids more low parity liters than from the negative ones. I don't know. Did you check that?
So we did not. Carl's did on some of his work where he looked at individual litters. But overall for us, it was whatever was processed that day. They all go together, and it is what it is. So we didn't specifically look at that.
Thank you.